The Steps Hip Spica Care DVD is made for parents and carers of children in hip spica cast. They are a series of mini videos which cover aspects of looking after a child in a cast. The videos are examples of how real families coped with everyday tasks of looking after a child in a hip spica. They are not meant to be fully comprehensive and cannot tell you everything you will need to know about hip spica care, but hopefully they will reassure you that solutions can be found to many practical problems. Remember that it is best to contact your healthcare professional if you have a problem you cannot solve. Parents, carers and healthcare professionals have reviewed these videos.
As for having a plaster off, I'm apprehensive. I want to make sure that, obviously, we want to know that it's worked this time. I know that it's going to be, it's one of the things where the consultant's a bit unsure of, because he said the socket is really quite unstable. We want her out of a plaster, obviously. We want her to be able to play outside with her friends and her cousins. We live on a farm. She's desperate to get out there with a pair of wellies on and play just the same as the other children. I'm also worried that we're going to have a hell of a week next week when she has the plaster taken off, because I know last time when she had the last plaster taken off, she got horrific cramps in the night and she was crying quite a bit. Took a lot of consoling, to be honest, and it's almost like losing part of you, the plaster sometimes. I think she was, although we want it taken off, actually having the plaster taken off last time was quite traumatic. But I can't wait to give her a proper bath, and again, dress her in a nice dress and make her look your pretty little girl. Although she's probably much more happier in a pair of jeans and a wellies outside when we get to it. But yeah, we are apprehensive, but we hope everything's right when the X-rays come back. So, when she came out of the plaster last time, what we found was they can't actually put the legs together at first for the first few weeks, because obviously they've been stuck out for quite a while, and if you're not careful, you have the tendency to try and put them in a pair of trousers that they're not used to, and they need to be in something that's quite wide. So I don't know how you cope with boys, because obviously putting boys in a pair of trousers would be a natural thing to do. I would think you would have to continue putting them in something quite wide, or similar to what they've actually been in with the romper suits or anything. And I know that would be difficult for the older children. With a girl, you are quite lucky, whereas you can continue to put them in, a dress that is, you haven't got that restriction, because I think when they come out of the cast, the obvious position is still going to be like this. So, and we found that we did hurt her a little bit, when if you did try and put her in anything that was unfamiliar to you. So that's one thing really that you have to watch for. So, well, obviously, with her being older, I'm wondering, will she need any physio? I don't know. The consultant last time said to take her swimming. So actually, because that would be a good thing for mobility, get her using a leg in there, because obviously it's not been used for such a long time. It's 16 weeks in plaster and not being used. Although she moves that little foot around at the end of the plaster, the rest of it you would think would be quite stiff. But that's going to be something that we're going to see, isn't it, when she comes out of plaster?
Sometimes the cast is actually removed on an outpatient basis. However, Amelia's parents have actually come prepared for an overnight stay. Amelia's going to be admitted onto the ward before the plaster is removed.
He's so shabby.
Waiting's actually really hard, and you're bound to feel worried and apprehensive.
Yeah.
He was introduced to this little one before. Ooh. Is that right?
Distraction can usually help, but most small babies and toddlers will usually become upset because of the noise and the vibration of the saw. There's not an awful lot that you can do except for being near your child and comforting them. The plaster technician usually tries to get them through the procedure as fast as they can. After having her bath, Amelia's a lot more settled. You can see how stiff her legs are, and she's still even holding them in the shape of the plaster. It is really normal for the skin to look red and scaly, but this soon settles down.
Remember, you are not alone. When you want information, advice and support, our helpline team are here to help you. No matter how big or small your concern, please email or telephone our helpline. Get instant access to information 24 hours a day via our website, where you can download our advice leaflets. You can also visit our online chat forum, which provides a fantastic resource of helpful tips and practical advice written by parents who are coping with a child affected by hip dysplasia.